Welcome back to our ongoing series. We're talking about discrimination in healthcare. Today, we're diving deep into an issue that affects many different lives and discussing the various racial disparities that exist in health outcomes.
With the evolving landscape of healthcare research, there's an escalating need to understand patient perspectives and preferences. At the Methodologists, we specialize in integrating and leading qualitative studies in your work, allowing researchers, pharmaceutical companies, or other individuals to delve into the profound narratives of patient preferences and experiences. The Methodologist is here to assist you in intertwining and integrating patient experiences and perspectives in your work. Connect with the Methodologist today, and let's pioneer a journey together to humanize research and elevate the voices that are pivotal to the design and delivery of healthcare interventions. Get in touch with us by emailing info@methodologists.org or by filling out a form on our website, www.methodologist.org/contact-us, and I look forward to hearing from you.
These disparities are not just mere statistics. They represent real people, real lives, and real challenges. And it's alarming to really reflect upon the disparities that exist based on race. For example, for heart disease, African Americans are 20% more likely to die from heart disease compared to white Caucasian individuals. Hispanic and Native American populations have a higher prevalence of getting diabetes, nearly double that of white Caucasian individuals. And just recently, the example of the COVID-19 pandemic. The pandemic showed that Black and Latino populations were at least 3 times more likely to contract COVID-19 and nearly twice as likely to die from the virus compared to white Caucasian individuals. These numbers are not just data points. They represent a grave reality that many racial and ethnic minorities face daily. But why do these disparities even exist? A significant part of the answer to that question lies in the socioeconomic factors. Marginalized, vulnerable, racialized, and minority communities often face things like limited access to quality healthcare facilities, economic barriers that prevent regular checkups and treatment, residing in food deserts where nutritious food options are scarce, ultimately leading to health issues, and limited access to health education and other resources. If you haven't already, please take a look at our social determinants of health course on our learning platform, learn.methodologist.org. In that course, we dive into each of 12 social determinants of health with case studies to really help you understand the impact of these factors on health and well-being. But coming back to the topic, beyond socioeconomic factors, systemic racism plays such an important role in shaping these disparities. Systemic racism and discrimination manifests in healthcare in a variety of ways. Let's talk about them. Biases in medical research, where Caucasian white individuals are often more likely to be enrolled or actively recruited, which leads to evidence for a specific group of individuals that may not be tailored and personalized to all racial and ethnic minorities. Second is discrimination in medical settings, which ultimately leads to mistrust and reluctance to seek further care. And finally, there is the unequal distribution of healthcare resources in racially segregated areas. And this is documented in a continuation of the Jim Crow laws that existed in the 20th century. Systemic racism and discrimination creates an environment where communities face many challenges, both direct and indirect, leading to poorer health outcomes. Understanding these disparities across race, gender, age, and other characteristics is important to understand the whole picture of healthcare. It's not just about recognizing the problem, but actively working towards addressing and coming up with solutions. But that's all for me. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, subscribing. Until the next video. Take care.